and welcome back to the Dental Hygiene Basics podcast. My name is Dana. I am your host and always excited to be here and help you guys on your journey to becoming registered dental hygienists. It's so exciting that you're listening to this and you're wanting to, do everything you can to be successful in this program. The fact that you're showing up today listening, I want you to give yourself a pat on the back and be proud of yourself because what you're going through is really, really hard, but you're going through it, right? And you just have to keep putting one foot in front of the other, or one scalar in front of the other, right? And just keep pushing forward because you can do this. I believe in you. I know you can do this. So that's your little motivation for today. Whether you are, let's see, in your first year or second year, but if you're in dental hygiene school right now, I know that you are going to have some competency, some exams that are testing you on your instrumentation. This particular episode is designed specifically for students who are getting ready to take their clinical exam for licensure. And this may be the ADEX or the credits exam. Both of them are tested on a mannequin, and you have to pass this test to get your license in every state, okay? Or most states. I think California, you don't have to take this exam, but then if you don't, you're limited to practicing only in California. So I'm going to encourage you to take the exam if you are interested. If you think you ever might move to another state someday, go ahead and look into those options and take the exam so that it makes your process a little bit easier. Okay, that's another story for another time. But let's say that you're getting ready to take this clinical exam. I also want to factor in that these tips are going to be good whether you are getting ready for that clinical exam or if you're taking a mock exam on a typodont in dental hygiene school, which I know all of you will have to do at some point, whether you're in pre-clinic or whether you are in senior clinic getting ready to take this exam. Oftentimes, you'll have to do a mock at some point and you'll have to demonstrate that you can remove calculus. That's the purpose of these exams. Can you do the role of a dental hygienist safely and competently? Now, for these clinical exams, the ones specifically to get your license, I want you to remember that they are testing to see if you are minimally competent, that you are safe to treat the public. Okay. So you need to go in there and just make sure you get that calculus off while keeping the tissue protected. I know that you can do that. You've made it this far. You'll continue to push on. And the goal is to just get a little bit better every single day at instrumentation, right? We aren't going to be perfect dental hygienist ever. So, if you think that you're going to be perfect every day of your career, that's just not going to happen. But, we can't get there overnight. We have to keep working on this day in and day out. And our skills, can improve over time. Okay, a couple of things that I want to mention. You may hear some misinformation about studying for this or preparing for this exam. Some students will say, use dull instruments or don't use a Cavitron. I want you to treat this exactly like you would any other patient. With any other patient, you would likely use your powered instruments, right? If it's significant calculus, which is what you're going to have on these exams. And you're also going to go in with sharp instruments. If you use dull instruments, you're more likely to burnish the calculus, which means you just remove the outer layer. So you leave a chunk of it on there. And once you do that, it's much harder to remove, especially with hand instruments. Or you're going to wear your hands out, right? You're going to get exhausted because you're using not sharpened instruments. That's super tiring. Or you're just going to potentially cause trauma to your patient. It's going to be more uncomfortable for your patient. Now, I know for the clinical exam, this is a mannequin, so patient comfort is out the window. But the things that we do to make sure that we take excellent care of the patient and we make this as comfortable as possible for them and as safe for them as possible, we follow the principles of adaptation, angulation, activation, right? You learn this in pre-clinic, and those are the skills that you should be relying on day in, day out. If you are properly adapted, properly angulated, you will not cause tissue trauma and it will be comfortable for the patient. So treat the mannequin like it's your real patient, right? And remember, they do take off points for trauma. So we have to protect that tissue. And if you go into it with the mindset of, I'm going to treat this like a real patient, it can kind of help you to just think of it, think a little bit more gently about what you're doing. Okay. Some other tips that I have that may be just random. They're instrumentation tips when you're preparing for an exam like this. Remember, when you're using powered instruments, we only use the level of power that's needed to get the job done. So whether you're testing in the clinic on a real patient or whether you're taking this clinical exam on a mannequin, test the Cavitron or piezo power out on the calculus and see how much power is needed to remove it. You don't need to go higher than that, right? So you get it to a level, you test it out, you turn it up a little more, you test it out, turn it up enough to where the calculus is coming off easily, right? And you don't need to go any higher than that with your power. What I find a lot of people do is they're like, this is the power I set it on for calculus removal, and I never change it. And that's really not right, because everyone's calculus is a little bit different. And you may be causing unnecessary discomfort if you have the power up too high. And you may cause unnecessary trauma to your typodont on your clinical exam if you have the power up too high. So remember, keep the power level just what it needs to be. Do what I call a test tooth. Okay. So your test tooth on your clinical exam or in a competency, whatever you think, is you're getting the hang of that calculus. How much power is needed for it to be removed? How tenacious is the calculus? Once you get the hang of that, practice on that one tooth and practice just getting all the calculus off on that one tooth. Because let's say that you are testing on a mannequin. It's different. It's different than a patient, right? There's not saliva, there's no blood, right? Things that we're used to, which is a good thing because you have better clinical visibility, which means you can see better. And so if we're thinking through the fact that this is a little bit different, it can help to release those nerves and make you feel a little bit better if you dedicate one tooth to being a test tooth. So you start that lower power, you're raising it up, and then you're going to clean that one tooth. You're going to clean it with the powered instrument. You're going to clean it with the hand instrument. You're going to explore on that tooth. Do everything on that one tooth and see what it's like. Okay. Get the hang of how the tissue feels, get the hang of how tenacious the calculus is. That way, you know what to expect for all of the rest of the teeth. And if you make a little blip or you make a little error, maybe the cavitron's up a little high, you get a little scratch on the typodont tooth or something like that, you can adjust for future teeth. And you make any little tiny errors. I'm not encouraging you to make errors, right? But I just want you to get comfortable on one tooth and then kind of take some of the fear out, right? If you don't take the time to kind of get acclimated to the typodont on one of these clinical exams, and then you just kind of start moving through all the teeth, you may not realize that there's something you could pivot on if you recognize, oh, I'm realizing when I insert like that, it really stretches the tissue. I'm going to make adjustments on future teeth, right? So we take a little moment to have a test tooth, okay? The other thing you can do on these clinical exams is figure out how much time you have and then give yourself a time limit for each tooth, right? Give yourself a time limit for how long you're going to be able to probe. Give yourself a time limit for how long you're going to calculus detect, and give yourself a time limit for how long you are going to clean the teeth. Now, with that, I had an instructor who recommended that I take 5 minutes per tooth on a competency exam. And, this was based on how long the exam was. And I found that to be very helpful for me. Now, some people will say, well, if this is on a real patient, if you spend 5 minutes on a real patient, you could cause damage to their tooth. You know what I mean? But the thing is, you're not just scaling consistently for 5 minutes straight. What are you doing? You're using the piezo, you're using the cavitron, whatever powered instruments you're using, and then you're coming back with your scalers, and then you're exploring. You're feeling, if you feel something, okay, what do? You pick your scalers back up, you go back in, but you're giving yourself time, one, to get used to that calculus, two, to explore, right? And if there's nothing there, you're not going to keep going over it. You're just going to ensure. But the purpose of the 5 minutes per tooth or whatever time designation you give yourself is to make sure you stay on track. If you start on a tooth and then all of a sudden you realize, oh my gosh, I spent 15 minutes on one tooth. Okay, we're going to need to adjust. Something's not going right if you're spending that long per tooth, right? It could be that you need more power. It could be you're not angulating or adapting correctly. So we use that as another metric to make sure that we are on the right track. Now, one thing I think we forget about from our preclinic days is that there's different stroke types, and I think that they are often underutilized. Usually when we are doing a stroke, we'll use vertical or oblique strokes. Those are the most common. But I think the horizontal stroke is highly underutilized. You can go pick up your fundamentals of dental hygiene instrumentation textbook, flip to the stroke chapter and find the horizontal stroke, because this is really, really helpful to get around line angles. It's also really helpful on the direct buccal and lingual. It's a great stroke if there's a tiny piece of calculus on the direct facial or direct lingual, especially on a little anterior tooth. But I love to use the horizontal stroke when I'm exploring, especially on a mannequin. I find that you can just get down a little bit further on those direct buccal lingual surfaces and scoot around the line angle and feel things that maybe you wouldn't have felt with just the vertical or oblique strokes. So if you're not comfortable with the horizontal stroke, I recommend looking up in the textbook, asking for help from your professors before you go in to take your Manikin exam. It's just an extra tool in your toolkit that can help you feel a little bit more confident. Because if you're like I was in dental hygiene school, I remember feeling like, am I exploring right? It takes time, honestly, to get comfortable feeling for calculus. And if you have those doubts, you want every stroke type available in your toolkit to make sure that you've tried everything you can to ensure that that you felt the calculus and that it's gone. The last tip that I want to leave you with your powered instruments. Remember, powered instruments are different than hand scalers for a number of reasons. With hand scalers, when we are scaling, what do? We have to go into the pocket, we have to get under the calculus, and then we remove the calculus in a coronal direction. That means we are moving towards the crown. We are not pushing down towards the root of the tooth, right? With a powered instrument, it's the opposite. You are moving in an apical direction towards the apex or the tip of the root. So you need to get above the calculus and work your way down. I find that a lot of students just go straight into the pocket and they just start doing back and forth sweeping strokes over and over and over again. That's not necessarily bad, but what could potentially happen in deeper pockets is you could just get the calculus at the base of the pocket and you could leave it halfway up, right? So what you need to do is start at the gum line and swish, 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 swish. If you can watch, if you're watching the video, you're going to sweep, 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 sweep in little tiny sweeping motions, starting at the gingival margin, working your way down to the base of the pocket. Then you go up again, you move a little bit further over, maybe about a millimeter or two, and you're going to do the same thing again. You're just going to do multiple little sweeping strokes, but you're going to be moving, a little bit each time, and you're channeling off that calculus. Super, super important. Speaking of channeling, there is another way when we're using our hand scalers, you don't want to get right under the deposit and try and take the whole thing off. You want to take it off in sections. Okay. So when you get in there and you identify where that calculus deposit is, slide back and try and find the beginning of the deposit, find the edge of it, and then chip off that one little piece and then scoot in a little, chip off the next little piece, scoot in a little, chip off the next little piece. Take it off in little tiny chunks. Don't try and get under the calculus deposit and take the whole thing off. That's another way that you are likely to burnish the calculus. Okay, before we wrap up, go back and review the chapter on insertion in your dental hygienation textbook. We are supposed to insert at 0 degrees. If your face of your instrument is perpendicular to your tooth, that is 90 degrees. So what do we have to do to get to 0? We have to close the face of the blade. It needs to be as close to the tooth surface as possible. Then we slide below the gum and then we open the blade back up to 70 to 80 degrees, which is our ideal calculus removal stroke. So go back and review these steps of insertion, because if you start tugging on this Manikin gingiva too much, remember, this is not a real patient. And a real patient with a lot of inflammation, the gums are super flappy, right? They're just flapping in the wind. That's because as disease worsens, those super gingival fibers that keep the gum snug up against the tooth, they start to disintegrate. So the gum gets really flappy. Well, the Manikin exam, the gums are not going to be super flappy like that. So we have to insert properly so that you don't cause trauma. Okay, those are all of my tips. I wish you the best of luck on all of your exams. If you have questions, reach out. We're here for you guys. Best of luck on your journey. Future registered dental hygienist.